So when I was a med student, I absolutely hated the idea of learning x-rays, and every time my attending would hand me a couple of x-rays, I would just pass out. So I made this cheat sheet of high yield x-rays for myself, and I was in my final year of med school, and it helped me a ton, and I really hope this helps you all. We'll not do the whole ABCDE version of x-rays because it's really unnecessary when you're solving questions and all you have to respond very quickly during the words. So let's get started. Rule number 1 is anything white is either fusion or collapse or consolidation or mass, and rule number 2 is anything black is air, right? Now I'll ask you some questions and let's see how much you know about x-rays, right? Now what is this? What do you think this is? Well, this is normal lungs, and this is a completely normal x-ray. This is some basic anatomy. These are clavicles, this is the trachea, this is the carina, this is the heart, this is the right and left hilum, this right here is the breast shadow, these are the hemidiaphragms, this is the costophrenic angle, this is the cardiophrenic angle, right? Now what is this? This right here. In this we can appreciate obliteration of costophrenic and cardiophrenic angles of right lower lung field, and there is a big lung field. And in the question stem you found out that the patient had pleuritic chest pain and the patient had dyspnea. Now what is this? This is pleural effusion, and when I was in my general meditation, my attending gave this really nice analogy for pleural effusion, and he said that when you put water in a glass, the water works towards gravity and it stays at the bottom, right? So think of a glass and water in it, right? This is the glass and this is the water. These are two glasses, right? And water is in the right one and it is at the bottom, right? You can see water right here till here. So this is effusion, this is fluid in lungs. And how I classify it is, if it's unilateral, it can be malignancy, it can be hemorrhage, it can be chylothorax, right? If it's bilateral, it can be fluid overload from heart failure, from liver failure, or renal failure. What is this? Very simple but very important. This is a consolidated mass in the right middle lobe. And what is the most common cause of lobar consolidation? Pneumonia, right? Good. Now, what is this? This right here. Well, we have hyperlucent overinflated lungs and flat diaphragms, right? The lungs look like really giant balloons and there's a lot of lung volume, right? So what is this? In the question stem you found out that the patient is a smoker and he's obese and he has chronic cough for around 2 years. And another question was that the patient was tachypneic, he was thin, and there was a history of liver disease. So in this case, the patient had chronic bronchitis, and in this case, the patient had chronic bronchitis, and in this patient, the patient had emphysema. So basically, the patient had COPD, right? So hyperlucent overinflated lungs, COPD. Now, what is this? Everything is black. So there is presence of air and there are no vascular markings, right? You can't see any vascular markings. And the patient had shortness of breath, acute chest pain, increased heart rate. What is this? Very simple. Pneumothorax, right? Very good. Now what is this? These are the hilums. There are some balls here, right? Bilateral hilar lymphadenopathy, characteristic of sarcoidosis. Patient can be an African American lady with skin nodules on her legs. What is it called? Erythema nodosum uveitis, and the patient had hypercalcemia. Now what is this? Very important. The patient, so in this x-ray we have curly B lines and increased vascular markings. The patient had dyspnea, the patient had pink sputum, and there was liver enlargement. What is it? Pulmonary edema. From what? Left heart failure, right? Good. What is this? Very important. There are multiple scattered and defined opacities. Good. Cannonball Mets. What is it? Metastatic lung cancer. There can be history of renal cell carcinoma or choriocarcinoma. Do look for really high BCG. What is this? very important. We see this a lot in pediatric age groups. Cystic spaces in both lung fields, recurrent pneumonia, foul smelling sputum, and clubbing. Good bronchiectasis, and this patient might have what? Cystic fibrosis. What is this? This giant bubble right here. It's a thin walled cavity in the right upper lobe with F fluid level. What is the most common cause of this? What is this? Liver abscess, lung abscess, right? And what is the most common cause? Aspiration of oropharyngeal materials. That was it, and really hope you enjoyed this video, and I really hope that this helped. Thanks for watching.